morning, everybody, and thanks for joining us here on KXAN Live. I'm Will Dupree, coming to you from the KXAN Live studio. Right now, we're going to go to a news conference that's happening virtually, of course, as you see there, from the Texas Children's Hospital in Houston. Two top pediatricians from that hospital are going to address questions, concerns, and other impacts of the ongoing shortage of baby formula. Let's take a listen as that gets underway again from the Texas Children's Hospital.
If you could mute your speakers, everybody, and your microphones, that would help us.
Wonderful. Love is hard to find and even harder to...
1 second. KHOU and KXAS, could you mute your speakers and your microphones? Thank you, guys. So joining me now are two leading experts from Texas Children's Hospital. I want to start off by introducing Dr. Stan Spinner, who's our Chief Medical Officer and Vice President of Texas Children's Pediatrics in Urgent Care. Also joining me along with Dr. Spinner is Dr. Amy Hare. She is a neonatologist and also the Program Director of Neonatal Nutrition here at Texas Children's Hospital, located in the Texas Medical Center. And Dr. Spinner, I want to start with you on this. You oversee more than 70 offices of our Texas Children's Pediatric offices. Those are our doctor's office for our children, and urgent cares all across Texas. And I know you guys and your physicians have been inundated with calls from moms and dads asking what to do. Start off by describing for us what you're hearing from parents right now.
Sure, thanks, Natasha. So what we're getting a lot of questions about is, can we use different formulas? What kinds of formulas can we substitute for, whatever formula that baby may be on? Or where can they get more formula if they can't find any? And then we're also getting questions about, can we make formula? Can we dilute formula? And I know we'll talk more about that, but, those are the kinds of questions that we're getting quite often across our practice sites.
And I know you're getting it on the phone, in the MyChart apps, and emails, things like that. And we just thought it would be great to come together to really separate fact from fiction for parents right here in one forum. I want to bring in Dr. Hare, and more from the hospital side. And Dr. Hare, being in neonatology, you obviously are receiving tons of questions from desperate moms and dads about what to do. And all of us here at the hospital, most of us are parents, and it's hard to think about being in a crisis like this where you're thinking, where's my next batch of formula going to come from? It's scary and downright stressful, and we definitely understand that. You've recently been getting some calls, well, lots of calls about donating breast milk to help other mothers. What are people asking you, and what do you recommend when it comes to that?
No, thank you. And you're absolutely correct. Our families are struggling, and we want to give them the best information possible. So I do get a lot of requests regarding, we call it informal milk sharing. So the thought is you can't find formula in the store, but your neighbor down the street has some leftover breast milk, or you can order breast milk online. And we just really want to, while the thought is good, we really worry about risks to babies that parents may not be aware of. So infection risk, bacteria risk, there can be additives in the milk that you're unaware of. And so, we really want to kind of move away from that. We do, if moms want to give their milk, we are happy at our milk bank to accept the milk. We send it to a special milk bank facility where they pasteurize it, and then we can use it for premature babies. So we do have a way to donate milk, but we would not recommend families trying to buy milk online or sharing milk.
And Dr. Hare, I'm glad you brought that up, because we get a lot of calls about our milk bank, people thinking that that's a way you could come get milk as a parent, or just maybe even donate it to a mom in the hospital that's in our NICU, but not how it works. Talk to me a little bit more about how it works and where our milk goes up north in Texas.
Yeah, no, definitely. So mothers that have extra milk, usually their babies are born on time and they just have extra milk that they'd like to donate. And what they can do is they can go to our website, fill out a form, and actually deposit the milk here. We're a depot. So what we do is we help with the paperwork, take the milk, and we do send it to the North Texas Milk Bank. That's where they are able to pasteurize it and treat it and get it ready for our preterm babies.
Dr. Spinner, I want to go to you now to talk about some of the do's and don'ts, and really there's a lot of myths out there of what you can do and what you can't do. What would you say are some of the top, or maybe the number one thing that you want to tell parents right now that they shouldn't be doing when it comes to formula or diluting formula? And we've heard it all on Facebook pages and everywhere else. What do you think?
Yeah, there are a few number one don'ts, and let me just elaborate just a bit. So we really don't want our parents to try to make their own formula. You know, there are a lot of YouTube videos out there showing how to do it. I've watched a couple, and boy, I tell you, these moms look really convincing. But it is extremely complicated process of the right, combinations of fats, proteins, carbohydrates. And if it's not done under strict guidance and expertise, the baby, again, we're talking about, very little babies, it doesn't take much to affect them, can have severe problems with, anemia, kidney problems. It can be very, very dangerous. So please do not try to make your own formula. Number two, diluting formula to try to make it last longer, to go longer. We've seen that happen for years from time to time for various reasons. And what happens is when you're giving your baby diluted nutrition, they're going to suffer the consequences. Again, they can become anemic. They can have other problems as a result of the fact that they're not getting the proper balance of nutrition from that formula. Mm-hmm. And then the third really no-no is, again, trying to buy formula online, because these people are out there trying to sell you things. We don't know the quality of the formula. We don't know if it's been, how it's been changed or what they put in there. So you really, really need to be careful. I know it's difficult when you really are looking for, I got to get formula for my baby. Yeah. But you got to do it in the right way.
And you brought up a good question. I have a couple questions now that have popped up into my mind. Let's talk about that, Dr. Spinner, and Dr. Hare, please intervene if you have some thoughts. When we think about buying online, people buy online, obviously the go-to is Amazon. And the stock just hasn't been there for obvious reasons. Then people try to buy from Amazon Canada, different places like this. How do we know if it's legit? How do we know that this formula hasn't been tampered with, that maybe it's just the packaging and not the real formula? Those are really scary realities.
Yeah, that's the big concern we have, is that we don't know that. So that's why it's so important to not go out and buy formula unless it's something that, the FDA has approved, and it's really regulated, which is one of the problems with trying to get that much more formula back onto the market, due to the shortage. But yeah, it may look very legit in the packaging, but it doesn't mean it's legit on the inside.
Yeah, and sadly, sometimes you don't know until it is in your baby's body and have to possibly see a doctor. So you want to be careful on that. Thank you for that, Dr. Spinner. Dr. Hare, one thing that I think a lot of people have been discussing is whether or not they can, well, of course, there's the donated breast milk. That was number one. What was number two on your list? Remind me about myths that parents have maybe been following and maybe they shouldn't be doing.
Yeah, no, I think Dr. Spinner has brought up a lot of the key points, we want to get out to families. But one, I think I already mentioned it, like you said, we don't buy milk online, don't share milk with your neighbor. And, also, I think there are many term formulas out there. If your baby's born on time, there are many formulas that are very similar. Now the brand names are different, yes, and we all like our brands. But for normal formula, the ingredients are completely the same. And so I would tell parents for that part, you do have options. We are seeing not a little bit of difficulty in our complex medical babies. So babies that have special needs, they may have gastrointestinal problems or kidney problems. And so they, require very select, choice of formula, but there are substitutes for that as well. So I would just encourage parents, I know they have to go to multiple stores, but, and with talking with your pediatrician, try to be open to using a different brand.
I think that's a big one. Really, as a parent myself, new parents, especially when you find a formula that works for your child and they're sleeping through the night, maybe they're not having acid reflux anymore or any kind of colicky, you're like, I'm sticking with this one and that's that. And I don't want to change. Like, you get it as a parent, right?
Totally.
But let's discuss, okay, if you have a brand name in one hand and maybe you have a store brand on another, and looking at those ingredients, sometimes they really match. Talk to me a little bit with your expert opinion about what else they should look for. If they're, they can't find their brand name stocked, but say they go to whatever box store and they turn it around, look at the ingredients and it matches. Are there other telltale signs that things that need to be included so they can be confident that this is good stuff going to their babies' bodies?
Yeah, no, you bring up an excellent point. For a normal term formula, you know, the additives should all be very similar when you turn the can on the back. Some of the carbohydrates might be slightly different, but again, these are, if you go to a reputable source, a store, these formulas have been, you know, passed through the FDA. So we know they have the amounts of nutrients and minerals and additives that babies need and are safe. So there really aren't differences. Maybe, like I said, depending on the carbohydrate they add to it, but that should not affect your baby, you know, how they feed or how they tolerate feeds or anything like that.
Let's change the topic to cow's milk now. We know there's ages that our pediatricians say, okay, at this set age, you can try regular milk, whole milk or 2% for your child. Some people have thought, can I bend the rules? Is it okay? Because obviously I can get that on the shelf. When's it not okay? What do you guys think about that?
Well, you know, traditionally we have always recommended waiting until the baby is a year of age to switch from formula to usually to whole milk, and then usually then with an iron fortified vitamin because the milk doesn't have enough iron in it to prevent anemia. The American Academy of Pediatrics just came out with a statement stating that if you are really in a bind and cannot find formula on any given day, if your baby is healthy and is at least 6 months of age, you can give whole milk again with some iron fortification temporarily, you know, 2 or 3 days, not for longer periods of time, because again, it's not designed to give the proper nutrition for these younger babies. But that's the best advice we could give. If you can't find formula today or tomorrow, you can make do with that. But please understand, this is, again, a very short-term fix, because then the next day or the day after, hopefully you will have found formula, and then you'll be able to resume, you know, whichever that formula is going to be for your baby.
A question we've been getting from the media here in the public relations office, even as recent as this morning, is, are we treating any patients that have come in, maybe to the emergency room, maybe through our pediatric offices, and have, you know, had adverse reactions from either diluting formula, not having proper nutrition, things like that? We fielded a lot of calls, but I know nationally the news stories are pointing to some cities on the East Coast that are treating some children right now. Obviously, since we're not treating those children, we can't comment on their certain situations, but that's a true reality, Dr. Here, that's happening, and it can be prevented, right?
Yeah, no, I mean, absolutely. This is our biggest concern. As Dr. Benner said, you know, switching to something other than term formula that is, you know, designed for term babies, you know, there's just high risk of, you know, intolerance. Babies can lose significant amounts of weight. There can be electrolyte issues. That's our biggest concern. And there are actually case reports from this in the literature for times when either formula wasn't available or there was a certain case study. So we've seen it in the past. And, you know, I think we're here to educate parents, because we don't want you to have to bring your baby to the hospital. You're trying to do the right thing and feed your baby, but there's certain guidelines we need to follow.
You know, one other question that's come up recently and is a really big story nationwide is about babies with milk protein allergies and how to really, what do you do about that? Of, you know, that it's something that moms have to deal with early on, and now here we are in this shortage, this crisis in some areas. What would you recommend?
Well, I'll jump on this one first. Yeah, you know, there are some very specialized formulas that are available for that type of problem. And what I would say is that if you can't find the formula that your baby typically is on for that, because again, we're talking about such a specialized formula, I would, you know, talk to your pediatrician and let him or her give you advice, because there may be a substitute and it may be something you can find. The other thing is our pediatricians are usually able to contact our formula representatives, and our reps have been helping, especially in those cases when there's really specialized formula needs. They can sometimes manage to get some of that formula, you know, available temporarily for some of our, you know, kids. So take advantage of your relationship with your pediatrician. I know, again, we're getting those calls, and our pediatricians are certainly trying to help in those circumstances.
You know, in your time and in your vast amount of experience, Dr. Spinner, being a pediatrician, a leading pediatrician in the Houston area, I know you have experienced this before. There's been baby formula shortages before. So if you can give us some insight to how parents got through that before, and maybe it brings us some hope that this can change and we can have things back on the shelf again and have some sense of normalcy soon.
Sure. Yeah, again, I think the overarching theme here is being understanding that it's okay to use other, to substitute other formulas, especially for most healthy babies that are on any given standard formula. So it's a matter of, and that's how we got through, the previous times. I would tell the parents, your baby may have been on formula A, but it's okay to use formula B. And back in, years ago, there was a lot less of the generic and store brands available. But as they were starting to come out, we would tell parents, if you want to use that particular store brand anyway, just because if it's less expensive, there is no good evidence to say that brand A is going to be better for your baby than brand B, or again, one of the store brand generics, again, in these normal cases. So getting the parents to understand that, or my baby's on a ready to feed because it's really convenient for me. I don't want to use a concentrate, or I don't want to use a powder. Well, if that's what's available, that's what you should be using. So that's how we got through previous shortages, by that flexibility and the parent understanding. And again, in the specialized cases, our formula reps were, again, they were there to help us and work with us to get some of those special formulas to our babies temporarily.
It just comes down to, Dr. Hare, getting that nutrition, having that baby have something that's of sustenance, right?
Oh, yes, definitely. And from the hospital standpoint, or just in general, exactly. We have many options. As Dr. Spinner said, it may not be the brand option. And fortunately, there are definitely more choices these days for even babies with cow milk protein allergy, or I've talked about some of our complex medical infants. So that is helping us a little, because there are different brands. And I do know that in particular, one of our specialized formulas, they have made more formula in the last 4 weeks than the last year. So I would like to applaud them for, increasing, their production and shipping to us quickly so that we can, help our most specialized needs.
Another question that I want to present to you guys, and this has been discussed again, but it's worth noting, the dangers of homemade formula. A lot of people are out there on the mommy Facebook sites, parent sites, websites, talking about, well, let's just take things into our own hands and make some homemade formula so we don't have to worry about this. So Dr. Hare, I think this is a decent question for you. What do you say to that?
Yeah, no, we have to be very, very careful. We do not recommend making formula at home. There are recipes circulating. I've seen some of the videos on YouTube, but one of the main concerns from a nutritional standpoint is that, for example, babies need calcium and phosphorus to help their bones mineralize. And calcium source, believe it or not, is not the same between plants and food and milk and how it's made in formula. So while you may think you're adding the right ingredients on paper, they're not absorbed the way that they should be. And so, it just leads to big concern that babies are going to get malnutrition, or they'll have these electrolyte problems and have to come into the hospital.
I want to also discuss, before we open up our forum to questions from the journalists online right now, about breastfeeding resources for new moms or moms trying to make more breast milk. I'm sure it's very stressful to do. It's a process that looks easy, but actually isn't. And let's talk about some of our resources at the hospital, Dr. Hare, and maybe some pointers that you can give moms.
Yeah, no, absolutely. At the hospital, I do know that we, in general, have a very robust lactation consultant service. So, specialists that talk to moms and help them with breastfeeding questions. But we definitely have had more questions lately. Moms are concerned that their supply won't be enough because they know about the formula shortage, or they're worried about their baby's latch. So at the hospital, we not only have in-hospital information and our lactation consultants, but we also have something called a baby bistro, which is an outpatient clinic. So you can make an appointment, and you and your baby can come in and get specialized help if you have concerns about a particular aspect of breastfeeding. But it definitely is, a concern for new moms, because breastfeeding is tough enough. And then if you're worried about your supply, so we're really trying to, also our OBs are working with us. They're starting at, we always educate, but they're re-emphasizing education even before moms have their babies, just so they know what to expect.
Yeah, because of course there's expectant moms now that are watching this going, oh my goodness, another stressor. It's enough stress and life-changing enough to bring a new life into this world, but now how am I going to feed my baby? And, will I be able to do it properly? Dr. Hare, thank you so much. And Dr. Spinner for both of your thoughts and analysis here. I do want to open the chat up to people who are joining us here on the Zoom forum. If you guys have any questions that we haven't covered, thoughts, anything, nothing's too off the wall. We've heard it all. But I think there's questions out there that parents, maybe haven't asked their pediatrician, and maybe parents that are on here, the Zoom with us, might have some questions for your specific story. So if you guys do have a question, please put it in the chat. And in the meantime, while we're waiting on that, Dr. Spinner or Dr. Hare, is there anything that I've missed that you want to get across that maybe parents have asked you, that you thought, oh, that's a good one, I would like the public to know and get that word out? Let's start with that. Is there anything that we missed?
There has been, of course, reports now that the one big plant up in Michigan, the Abbott plant, is going to be reopening. The FDA is working with them to get them back online, which is very good news. I think the main thing is to be sure that our families understand and have confidence in the system. It works. That's one of the reasons why, when there was some concerns about some bacterial contamination, the plant got shut down, which caused that was a big problem, because they were the major manufacturer of formula in this country, and so they did not want to take those chances. So again, we want to be sometimes overcautious rather than less cautious, and sometimes a recall may turn out to be, at the end of the day, maybe it wasn't necessary, but we don't know that, and we'd rather protect and prevent things than finding out the opposite. So the FDA is working closely with with the plant to be sure that it's opening, that it's safe, that the formula that's being produced is being produced again under the appropriate guidelines, and it's being produced safely, so that when it gets back on the market these next several weeks, that as parents, that you can be comfortable that you can buy these formulas again and know that you're giving your baby a safe formula. Again, that's because, again, when you start losing that confidence, it really causes problems. We really want people to understand that they're not rushing things, they're not doing things that too soon. They're doing it the right way, because we need to be sure that we always do things that way.
Yeah, better to be cautious for sure. Thank you, Dr. Spinner. I'm going to get to the questions right now that are coming in. One from Univision. Let's see. They say that viewers have asked them at the station, is it okay to buy baby formula down in Mexico and other countries in Latin America? Earlier in this broadcast, we talked about buying from Canada and the do's and don'ts. So who wants to take this one and just reiterate what we had said before? Dr. Spinner?
Yeah, this is tough, because it's tempting, to buy a product from where, if you can get your hands on it, but I would still be very cautious. We don't know how thoroughly that process is monitored in that country. I would say, especially for babies, when it's really, really critical to be sure you're getting a pure product, that I would not recommend doing that.
Okay, thank you, Dr. Spinner. Dr. Hare, here's a question from you from KO2U Channel 11. So I think this journalist last spoke to you on the topic a couple months ago when the recall first happened. How much do you think the situation has changed, they write, since we last spoke then? Is the shortage as worse as you've seen it in your career?
Yeah, no, excellent question. I do think since the last time we spoke, it doesn't seem like that long ago. But there's obviously been a lot of media. And so I think the good news is, I'm hoping we're on the upswing of the shortage, meaning, some of the problems have been addressed there. I know that, the FDA is working to kind of, get some of these formulas out to the public. So, and companies have responded by increasing production. And so I think that, one, just bringing awareness to this, and two, I do think we're going to start seeing more of our brands come back.
Yeah, that'll be nice to see. And that really is a big question that we touched on, but let's get to it more, because I think, okay, these are the same factories where there might have been a problem before, or they stated that there was a problem, and now we're going to reopen them. Natural question is, okay, how do we know things are safe? And Dr. Spinner, we talked about this offline, but talk to me about it and let people know, what a company has to go through with the government to be sure that they can come back into distribution. It's not just, okay, let's turn on distribution and the green light's going. They have to answer to the government, and also make sure that their facility is clean and safe, right?
Yeah, I think baby formula is one of the most tightly regulated products that we have in this country. When you, just as an aside, when you look at expiration dates on so many products, because I keep hearing from people about medicines, is it okay to give my child the medicine beyond the expiration date? And the answer is, well, most of those are just suggestions. Really don't know for sure, but formula is the one thing that expiration date is very meaningful. The FDA really is extremely methodical and uses the science and goes through a very set of guidelines to be sure that these plants are producing and packaging their formulas the best possible way to keep it safe, but also to be sure that it's nutritiously the right type of product. Because again, as Dr. Hare had alluded to, this is a really complicated process of making formula. It's not simply taking cow's milk, pouring it in a bottle, and adding some additional ingredients, which is what you would believe by watching some of these YouTube videos. It is extremely complex, and because of that, we have formulas that are excellent sources of nutrition. Now, again, breast milk is always going to be the best, but if you can't breastfeed, I mean, formulas are a very, very good source of nutrition because they're done right, and they're done with years of experience and knowing what's right for your baby. And those things have improved over the many years. So the FDA has always been meticulous about that, and they still are, and they will always be that way. So again, that's why it doesn't happen overnight that suddenly, we see, all the shelves, packed with formula again.
Right.
It takes time to be sure that all the ducks are in a row, everything's done right. To manufacture it, again, it doesn't happen that quickly. And then, of course, to get it to the, to the shelves.
As much as we want it to be that quick, we sure do understand we want to get it right, so we're not back in the same situation starting back in March as we were. Back to the questions, guys. Let's see, Dr. Hare, when journalists asked, besides milk banks, are there any other local alternatives for formula? We talked about our milk bank and how we provide up to North Texas and how that works. Take that question for us.
Yeah, no, so, unfortunately, the pasteurized donor milk from these nonprofit milk banks, like the one in North Texas, they're really meant for premature infants. And, one, because of the research that shows that it has numerous health benefits, protects them from infection, et cetera. And believe it or not, we don't have an overwhelming, excess of donated milk. And so, we really don't, because there are some cases where if a baby has a very complicated gastrointestinal condition, they may qualify for pasteurized donor milk, and that would be with a pediatrician letter, but that's very rare. So I think all of us, like if we had enough donor milk that's pasteurized and safe for the babies, I mean, we would be helping our families, but it is a limited resource, and right now is saved for our most fragile tiny babies.
Yeah, well, we certainly understand that for sure. Thanks for answering that. Houston Public Media asked a question that I think this is one I'm going to have to answer offline, but an interesting question about Texas Children's possibly partnering with some formula sites once the factories are up and running again. That's something, Eddie, I'll get an answer for you offline. When it comes to inventory and what Texas Children's will be doing. Right now, we're able to answer questions, be a guiding force for our parents. And obviously, as Dr. Hare had said earlier, some of that formula, the specialized formula, is focused and reserved for the sickest of the sick, our NICU babies that need it first and foremost. Well, if anybody, I'm going to give a couple seconds more. If there's any last burning questions from our journalists on the Zoom right now, I want to thank Dr. Amy Hare. And once again, I'm going to give everybody's titles in case anybody missed it. Dr. Amy Hare is a neonatologist. She's also our program director for neonatal nutrition at Texas Children's Hospital. Does that all fit on a business card, Amy? And Dr. Spinner, of course, our Chief Medical Officer at Texas Children's Pediatrics and the Vice President as well of Texas Children's Pediatrics and Texas Children's Urgent Care. I thank you both for taking time out of your busy schedules. I know you guys are very busy in your practices and leading each part of what you do here in TCP and TCH, Texas Children's Hospital. So thank you once again. I'm going to check the questions to see if I didn't miss anybody before you close. Another question is, are we seeing any Houston children with health issues stemming from homemade formula? And we had talked about this before. We're getting tons of questions, right, Dr. Hare, Dr. Spinner, but we haven't had anybody with such issues come into our doors, correct?
Not that I'm aware of. Certainly between TCP and urgent care, I've been checking on a regular basis, and the good news is that we don't seem to have had that happen yet, but that doesn't mean that it may not, because it may not happen overnight. So we need to not let our caution down, and we need to be sure that we're continuing to keep an eye out for that. I hope that we won't.
Right. And a quick pointer there, telltale signs if a parent needs to bring a baby to an urgent care versus an emergency room when it's something like this, a formula diet where you're thinking something's not right. What are some things you should look for?
You know, I'm going to say the things that we always counsel our parents what to look for, especially in our little babies. You know, poor feeding, not acting, you know, not waking appropriately for feedings, being listless, looking pale. You know, we talk about diarrhea. Well, a lot of babies, their stools normally are kind of diarrhea. So we want to be careful about how we talk about that. But if your baby is suddenly, you know, going from some kind of what you would consider normal stools to really runny stools, certainly that would be a concern. Any blood in the stools would be a concern. Vomiting when your baby hasn't been vomiting before. Obviously fever, you know, worrying about if there's any infection from a contaminated source. But just changing your baby's normal behavior. And it's hard, especially for a first-time parent with a young baby. They don't come with instructions I'm aware of. So, you know, that's why we get questions so often as pediatricians. So please, if you have concerns, you know, notify your physician, call their office. You know, our pediatric groups, you know, we're available, you know, 24/7 as far as, you know, being able to handle, you know, any kinds of concerns, emergencies. So if you see things that are just not right, it's better to call or, you know, to reach out to your pediatrician. Be safe than sorry about that. But again, major changes in their feedings and the behaviors and their alertness, those are the things we really want to be watching for.
Yeah, say something, go with your gut. Definitely great advice. Again, Dr. Spinner, Dr. Hare, thank you for your time. And journalists that have joined us, thank you very much for joining this Zoom virtual press conference. If you guys have any additional questions as you get your stories together throughout the day or something comes up, please reach out to any member of my staff. Our email is publicrelations@texaschildrens.org. Again, publicrelations@texaschildrens.org, and we'd be happy to help you guys today and throughout the time with any questions when it comes to medical needs here at Texas Children's Hospital. Thank you once again, everybody. Have a good day.
Thanks for sticking with us here on KXAN Live. Will Dupree back in the KXAN Live studio as we wrap that news conference with two pediatricians from the Texas Children's Hospital in Houston. That's the country's largest pediatric hospital in the entire U.S., and that's right just about 3 hours from Austin. But what they were sharing there was some information about for parents who have concerns about not being able to find the formula they use to feed their babies. We have reported extensively about the shortage that stemmed from a recall that happened in Michigan. A number of bacterial infections tied to products made at a plant in Michigan. The FDA has reached an agreement with the company that makes those formulas, a company called Abbott Nutrition, to get the plant restarted. Of course, that's not going to be a quick fix. So the doctors there were answering a lot of questions. They really wanted to assure parents that, yes, they know that parents have certain formulas that their children like, and if their child is healthy and normal, that another option will be just as good, even if that other brand they normally use is not on the shelves like they normally find it. So they're encouraging people to try those other options for their kids because they say the same nutritional qualities are the same regardless of formula for healthy, normal children. For those with more specific needs for feeding or additional nutrition added to the food, they're asking you to please contact your pediatrician because those pediatricians can often get in contact with baby formula representatives to get samples on a temporary basis to feed your child. So again, talk to your doctor about that. What the doctors are also stressing is not to use any kind of homemade formula. They are also saying for safety reasons, try not to buy it from another country or swap milk with a neighbor in some sort of milk sharing effort, because you just don't know what's in that milk exactly. You may not have that information readily available. So those are just some of the tips that we wanted to share from the talk we heard there from two pediatricians. We're going to break all this down in a story on our website. I'll be updating that shortly, so please stay with us here on KXAN. You can tune in and look at that article on KXAN.com, as well as look on it on the KXAN News app on your smartphone. So please keep that handy. Download it if you haven't done so already. We would appreciate it. Thank you all again for watching here this morning. I'm Will Dupree coming to you from the KXAN Live Studio. We'll see you back here throughout the day with other updates. Be safe, everybody out there, and take care.